Welcome to Chapter 10 of Exercise Programming for Special Populations. We will be talking about cancer today. And what a rough disease. But we'll talk about how we can work with these, clients as well. And also, again, exercise benefits everybody, even some of the toughest circumstances. So let's get through. So the pathology of cancer, malignant cancer cell has the following capabilities: sustained proliferative signaling, evading growth suppressors, resisting cell death, enabling replicative immortality, inducing angiogenesis, activating invasive and metastasis or invasion and metastasis, reprogramming of energy metabolism, evading immune destruction. A benign tumor has unregulated growth without invasion. So the American Cancer Society reports today 1 in 4 deaths occurred in the United States is due to cancer. United States, 86% of all cancers are diagnosed in people that are greater than 50 years of age, but cancer is also the second leading cause of death among children between ages 1 and 14 years in the US. It's viewed mostly as a genetic disease that occurs due to DNA mutation. It is brought on by exposure to carcinogens or occurring spontaneously. Other mutations may occur when certain genes whose gene production regulate DNA replication or repair are mutated. Again, page 53, for example, the P53 gene. It's page 53 gene. Yeah, the P53 gene is one of those. Tumor node metastasis systems gives 3 key pieces of information. So T for tumor describes the size of it and is ranked from T naught or no tumor to T4, which is an invasive tumor of the vital organs such as heart or lungs. The N, so the node, describes whether the lymph nodes are affected by the cancer. Again, it's scored as N naught, so not invasive, to N3. And then the metastasis describes the presence or absence of cancer metastasis to other organs of the body. So again, M naught means no metastasis, or M1 means metastasis is present. So the T and M descriptors of a given tumor have been defined. They are combined together in overall stage grouping comprised of simple set stages from stage 0 to stage 4. In brief, lower stage numbers, so stage 1, are used to describe small primary tumor, no metastasis, and higher numbers are going to be stage 4, are used to describe cancer that has metastasized to other organs or throughout the body, right? And again, when you think about it, if you didn't understand those parts yet, a lot of times, somebody would be like, oh yeah, I'm in stage 1 or stage 2, and again, any of you that have had family members or friends that have dealt with this, or if you've dealt with this, the stage 1, stage 2, definitely, there's a lot more talks of hope and remission and getting rid of it. When you get to stage 3, stage 4, things are, again, it's not that stage 4 cancer doesn't ever get reversed. It does. I mean, I'm pretty sure that's what Lance Armstrong has been. I used to be really up on the stuff that he went through with the cancer, but it's kind of so many years passed since we talk about Lance. But I'm pretty sure I know he had 2 different types. He had testicular and brain, or testicular and stomach, or I can't remember. He had 2. I think one was a stage 4, one might have been a stage 3. I don't know. He was in bad shape. Guy's still alive, beat it. So, but again, things tend to be more grave in those stages, right? So management and treatment, radiation therapy, local form of treatment targeting only the areas of the tumor, delivers high energy particles or waves through X-rays or gamma rays to destroy or damage cancer cells and prevent the growth and division of the cells. The cancer cell by breaking apart the DNA molecules inside the cell. Chemo involves delivering chemotherapy drugs through the bloodstream to treat cancer cells that have metastasized to other parts of your body. duration depends on different factors, including kind of tumor, tumor phase, person's tolerance to chemo, and the person's general condition. It can significantly reduce the risk of cancer reoccurrence after surgery. Biotherapy includes immunotherapy, biotherapy, biological response modifier therapy, and uses of a variety of large molecules to fight cancer or to lessen the side effects of some of the cancer treatments. So again, if you're doing radiation and chemo, they may use another type of biotherapy to kind of help with the side effects of, going through your body being destroyed by the chemo and so on and so forth. Form of treatment usually interferes with cancer cell growth, acts directly to help healthy immune cells control cancer in certain therapies, or helps to repair normal cells damaged by other forms of cancer treatment. Bone marrow transplant. Diseased bone marrow is ablated or destroyed using large doses of chemo agents, radiation, and both. And a person's blood forming system is then replaced with either bone marrow cells from the same person when he or she is in remission, autologous bone marrow transplant, or a tissue antigen match donor, allogenic. Again, it's one of those things. I'm on the bone marrow list. I've been on it, I don't know how many years. Never been called for somebody to come take it. It's one of those things that you really have to match up with someone to do it. So again, it's a good thing to get on. I know it's kind of scary because they tell you like it's painful. You're down for a little while after you do it and everything else, but the lives you could be saving. So if you've ever thought about doing it, I would recommend it. And again, there's no guarantee you're going to get a call either, because I think I've been on it for, I don't know, maybe 15, 16 years. And yeah. Hormonal therapy uses drugs to modify bone hormones, stopping their synthesis or changing their effects on specific cells to block tumor growth. Only some tumors are hormone receptor positive and respond to this type of therapy. Examples are breast and prostate cancer. Again, we you see all these treatments, and again, the efficacy of each treatment is, they're much smaller numbers. We just, it'd be great if we had some stuff that, like things that had really high working abilities percentage wise, but side effects of treatment depend on the type of radiation or drugs or the amount given and the length of treatment. Early side effects includes nausea and vomiting. I think I need more of this. And I'm out. I'll have to go get some more. Nausea and vomiting, temporary hair loss, increased chance of infections, fatigue, skin changes, loss of appetite, pain, hemorrhagic and thromboembolic complications, and allergic reactions as well. Late side effects are those that take months or years to develop, and some are often permanent. And severe side effects include toxicities in many body systems and organs. So sometimes the cancer may not kill you, but the treatment can, or the treatment can lead to, like other organs having issues, and then you got to figure out how to fix that. So, again, with the way that we have to treat it, you're trying to kill something, but at the same time, sometimes it destroys parts of you that may somewhat be healthy. So, it's one of those nasty disease. The cure is, there's not really a cure, but the ways that we fight it are not, they're not, they're not the healthiest things for you sometimes in the sense of what they do to your body. It's just, hopefully your body can endure what it's going to go through to get rid of the cancer. Then you can hopefully get healthy after that, right? So again, that's why it's such a rough disease, and it's rough to see people go through it. Cancer-related fatigue. Fatigue is the most common side effect of cancer, and cancer treatment affects up to 70% of those who have cancer during chemo and radiation and after surgery. Individuals are usually advised to rest and decrease their level of activity. However, inactivity promotes muscular catabolism and extended periods of rest may lead to chronic fatigue. Anemia, pain, emotional distress, example, depression, anxiety, sleep disturbances, nutritional problems, low levels of physical activity and medicines are possible causes of their fatigue. It's mainly caused by illness itself. Treatment and inactivity result in deconditioning. Sedentary habits usually recommended by the biomed staff and the family protect the person may lead to the development of self-perpetuating fatigue cycles as well. And exercise can improve this. Lymphedema can occur after lymphadenectomy, where they surgically remove your lymph nodes, and after radiotherapy that affects the lymph nodes. Diminished lymph flow can result in accumulation of interstitial fluid, inflammation, swelling due to lymph fluid buildup. Upper limb lymphedema is commonly followed by lymphadenectomy due to breast cancer. Lower extremity lymphedema is most likely with uterine cancer, prostate cancer, lymphoma, or melanoma. Healthcare professionals often warn individuals that they should avoid intense upper body exercise to avoid causing lymphedema. To date, however, there's no data that supports link between the upper body exercise and breast cancer related lymphedema. Alkylating agents, these are part of the chemo. They work in all phases of cell division cycle by preventing the normal processes of DNA replication, gene transcription, and translation. They're used to treat many different cancers, but can produce long-term side effects to bone marrow, and in rare cases, acute leukemia may develop with high doses. Antimetabolites, these are the most often used type of cancer drug. They work during the S phase to block purine and pyrimidine synthesis and distort the normal synthesis of DNA and RNA. They're used to treat cancers such as leukemia, breast, ovarian, and intestinal tract cancer. Anti-tumor antibiotics integrate into DNA-based pairs, preventing normal function and block tumor cell growth and multiplication. Anthracyclines interfere with enzymes involved in DNA replication, work in all phases of the cell division cycle. High doses can produce permanent heart damage. Again, you know, you keep seeing all this stuff slide after slide, and again, you know, it's one of those things. Sometimes, you know, the cure. You know, we've heard this term a lot during the COVID stuff. You know, where the cure can't be worse than the actual problem. And that's what you look at some of these things. Sometimes you're like, well, is the cure worse than the, yeah, and in some people it might be. A lot of times they're looking at, you know, hey, maybe once we can get you through this, we can fix this later or work on this later. Sometimes it doesn't. I mean, it's, you know, it's one of those, you're stuck between a rock and a hard place now. You've got to make a decision, right? And non-anthracyclines work as a topoisomerase. I can't ever say that one. Topoisomerase. And I probably still pronounced it wrong. 2 inhibitor. I've heard it, or I've never heard it said. I've always read it. So I think it's topoisomerase or isomerase. These inhibitors interfere with topoisomerases or enzymes. Remember, anything that has ASE on the end of it is an enzyme, which helps separate the strands of DNA to be copied during cellular S phase and can be a topoisomerase 1 or 2 enzyme inhibitor. And antimitotic or mitotic inhibitors interfere with structure and function of cell microtubules. Apparatus stop mitosis in the cell M phase and also can damage cells in all phases of cell replication by slowing enzymes necessary to synthesize proteins needed for cell reproduction. Corticosteroids are anti-inflammatory hormones that are used prior to chemo to prevent allergic reactions, nausea, and vomiting. Long-term side effects include muscle atrophy, osteoporosis, immunosuppression. Common types are prednisone, methylprednisone, and dexamethasone. Hormone therapy is used primarily against breast and prostate cancer and works by blocking estrogen in breast or testosterone in prostate cancer. Drugs that block estrogen, selective estrogen receptor modulators, work as estrogen antagonist in some tissue and as agonist in others. Relevant side effects include fatigue, hot flashes, mood changes, depression, increased risk of blood clots, especially in lungs, lower extremities, heart attack, stroke, bone loss in premenopausal women. Other anti-estrogen drugs are non-selective and can have side effects that include mild nausea, gastrointestinal symptoms, loss of strength, fatigue, pain, and bone loss. And again, we have a lot of folks in our bodybuilding community that like to take these drugs or other drugs that do estrogen blocking. And again, it's, you know, really highly not recommended. Treatments to lower estrogen levels. Aromatase inhibitors block aromatase in fat tissue and are used in women who have non-functioning ovaries. Side effects include mood changes, depression, heart attack, angina, heart failure, hypercholesteremia, muscle and joint pain, joint stiffness, and bone loss. Permanent ovarian suppression or ablation can be done surgically through an oophorectomy, removal of the ovaries. Ovarian suppression uses luteinizing hormone releasing hormone to reduce ovaries production and release of estrogen. Hormone therapy that lowers androgen levels. Orchiectomy is a surgical production in which one or both testicles are removed, which reduces blood testosterone levels by 90-95%. In a subscapular orchiectomy, only the tissue that produces androgens is removed. Luteinizing hormone releasing hormone binds to the LHRH receptors in the pituitary gland and also lessens testosterone production. Common side effects of hormone therapy in prostate cancer: hot flashes, loss of libido, changes in mood, depression, erection problems, growth or gynecomastia, and tenderness of breast tissue, shrinkage of testicles, penis, muscle atrophy, reduced muscle strength, bone loss, sometimes resulting in osteopenia, osteoporosis, and fractures, anemia, high cholesterol, weight gain, lower mental sharpness, fatigue, and increased risk of hypertension, diabetes, liver damage, stroke, heart attack, and death from heart disease. A lot of side effects, right? And it's one of those things, testosterone is such a wonder hormone. You know, and when you reduce it in men or women, there's a lot of issues. Now, again, doesn't mean that you need super high levels of it and you need to be dosing or anything either, right? There can be side effects on that side too. Effects of exercise. Exercise both during and after treatment will improve functional capacity, strength, functional mobility, fatigue, psychological well-being, health-related quality of life. Benefits vary, however, depending on the type and stage of the cancer and the volume of exercise program. Most research has been focused on breast and prostate, so more research is needed. Again, if you ever watch, you know, again, I know a lot of people have mixed emotions with Lance Armstrong. I'm one of those people, just because, man, what a beacon of hope he was. And then you find out he was cheating. You know, but if you watch his progress while he was sick, and he would exercise, he'd get on the stationary bike and do all kinds of you know, you see the benefits that it had for him. Now, doesn't mean it worked for everybody. Again, you know, and a lot of factors are going to go into that. You know, part of it is how sick is somebody. The other thing is what can they tolerate. I mean, obviously he was a very dedicated athlete who's willing to put up with and tolerate a lot. And maybe that's the thing, you know, I mean, you know, there's some speculation sometimes that it's like, you know, even if you don't feel like exercising when you're going through all this stuff, maybe pushing through the tough stuff may help. The exercise may help your body to improve the things that it needs to do, to also help heal your body and make you more resistant. Second thought process is that, you know, because again, whenever you go through good bouts of exercise, there's like a suppressive time afterwards where you rebuild, and a lot of people worry that during that time you're more maybe apt for infection or, things. So, again, I can understand both. I think if you approach exercise in the right manner and you can build up slowly, and create a tolerance, and if the patient or client will push through and just realize like they're never going to feel like doing it, but do what they feel is good for them, safe for them, and just be a bit out of their, again, you always got to be out of your comfort zone. It's never going to be comfortable. um may see better prognosis, if we could get more folks exercising. There's a lot of theory on it. There's a lot of good research to back those theories. It's just, again, it's a hard thing to fully prescribe, because you know most people don't feel like doing anything when they're going through this stuff. So it's a hard deal, and again, not a lot of research as of now. Aerobic training can cause a reduction in nausea, improve functional capacity, greater functional mobility, improve body comp, reduce fatigue, increase psychological well-being, improve hematological and immune system variables. Again, it's just hard to get people to push past the how they feel, to get this type of training done, right? Most people, most healthy people don't really like cardio. It's kind of hard to get somebody that really doesn't feel good, and is going through some rough protocols to try to save their life to do this as well, right? Resistance training can cause improvements in strength, mobility, flexibility, bone density, pain, fatigue, and overall quality of life. When aerobic training and resistance are combined, there's lower incidence of recurring breast cancer-related lymphedema, reduced severity of breast cancer-related lymphedema, no delays in immunological recovery, and improved chemotherapy completion rates as well. So again, a lot of benefits if you can get them to exercise. The recommendations are in 10.5 for adults and 0.6 for kids. Any guidelines must be individualized based on condition of the client. As the guidelines, no definitive guidelines have really been developed. Goals for exercise programming will be similar to those of healthy individuals. Exercise is generally safe for those who have cancer. So again, it's just, it's like you do with anybody else. You just take them where they're at, however bad they feel or how deconditioned they are, and you progress them slowly, right? And progress them, and again, this is going to be some folks that you got to encourage to like, they don't feel great, they and everything else, but just to encourage them, like, and even on days where you feel like you can't do anything, let's try to do something. It doesn't have to be, I know with a lot of folks, it's, in a lot of trainers, we have clients that are just lazy on certain days. There's nothing wrong with them. We want to push them on those days. We're like, all right, let's go, let's push, let's see some. These clients, the push may just be to actually go do something physical. Like even if it's just walking, and maybe it might even be a shorter walk that, they may absolutely feel horrible, but the fact that you get them to exercise some is better than none. And again, when they have those days and you have them go to those things, maybe those days, the amount of those days may start to be less and less as well, right? So aerobic exercise should be done 4 to 5 times a week at self-selected intensity duration. Again, it's based on the individual. Walking is a good starting point. Any large muscle group activity can be effective, assuming it doesn't interfere with recent surgical therapies. Resistance training can be done 2 to 3 times a week using 8 to 15 rep max intensity, 1 to 3 sets, 1 to 3 minutes of rest in between. Flexibility can be done 3 or more days a week. Intensity should not reach the level of discomfort. Again, medical clearance, I wouldn't even say is strongly encouraged. I would make it a must. That's just me, especially for individuals receiving treatment affecting lungs and heart. Side effects resulting from disease or medications will necessitate a reduction or cessation of exercise depending on their severity. Vigorous upper body exercise should be performed with caution. Reduced resistance or stop specific exercises according to symptom response, and precautions such as wearing compression sleeves, lifting arm above the head after exercise, and active light recovery may facilitate lymph return after exercise. And little is known about the effects of exercise on lower limb lymphedema. So again, just be cautious and observe, and just note what you see if you notice any changes. Exercise programs should be individually supervised. Again, I know we have design guidelines. Design guidelines usually affect mostly performance more than anything, especially when we look at sports performance. But even then, if we individualize for athletes with their stuff, now again, I understand, like when you're working with a whole team of football players, for the most part, each group based on their skill set, you do kind of the same workouts for everybody. But usually when you get a chance to work one-on-one with those athletes, if you really want to see major growth, we tailor each program. So even if I have wide receivers, if I work with 10 different wide receivers one at a time, they should be on 10 different programs. There should be some similarities, but there should be a lot of differences as well. It works all the way down. So you take the top tier athletes and we work our way down to those in the most vulnerable groups, based on, diseases such as this, or mental challenges or physical disabilities, and so on and so forth. This really should be the main thing, understood in everything. Individually supervised, individually designed, to make sure that they're getting the best care that they can. Aerobic training should begin with walking, should later consist of any type of exercise that is easily accessible and, again, that they can tolerate. Resistance training should consist, and again, with their goals, they should have goals, right? But not just like, okay, we'll see what you can do while you have cancer, going through cancer treatment, and whether or not you survive. I mean, that's not, give them goals. Again, goals give you hope. Right. I mean, that's a big thing too. It gives them something to look forward to, like, basically have the idea that they're going to beat this and that we're going to start working on achieving their post-cancer goals now, right? Just gives them hope, gives them inspiration, right? Sometimes we overlook the mental aspects of being a coach and what that can do. Should consist of at least one exercise of all major muscle groups. Volume and intensity will be progressed gradually. Clients severely affected by their condition, medical treatments, or both, or those highly deconditioned, an exercise program should begin at lower levels, right? That's it over the cancer chapter. I know it's a really kind of sad chapter to go over, but it's an important one. And again, great, this great population, it's a population that most of us know somebody or know somebody that knows somebody that's been affected by this. And again, exercise seems to play beneficial roles, and we need to understand that. We need to encourage that. We need to educate those who are educated with this, and we need to get, this population, as well as every population, to increase their working out, right? All right, that's it for chapter 10. See you guys in chapter